The HeartStart MRX Monitor Defibrillator integrates our industry-leading multi-parameter monitoring capabilities with our clinically proven and patented smart biphasic waveform to create a combination transport monitor, cardiograph, manual defibrillator, and AED. The MRX provides 4 modes of operation: monitor, manual defibrillation, pacing, and semi-automated external defibrillation. In monitor mode, you can monitor one ECG waveform acquired through a 3-lead ECG set and up to 4 ECG waveforms through a 5 or 10-lead ECG set. Optional monitoring of pulse oximetry, non-invasive blood pressure, invasive pressures, carbon dioxide, and temperature is also available. The HeartStart MRX stores up to 12 hours of monitored trending data that can be displayed in time intervals on the screen. In addition, monitor mode provides an optional diagnostic 12-lead function, enabling you to acquire, store, and print 12-lead ECG reports. While monitoring, alarms alert you to changes in the patient's condition. Manual defib mode offers simple 3-step defibrillation using paddles or multifunction electrode pads. Manual mode also allows you to perform synchronized cardioversion. The optional pacing mode offers non-invasive pacing therapy. In AED mode, the HeartStart MRX analyzes an 8-year-old to adult patient's ECG, determines whether a shock is advised, and guides you through the defibrillation process. The QCPR option provides real-time corrective feedback on the rate, depth, and duration of compressions, as well as when pressure is not released between compressions. It also provides the rate and approximate volume of ventilations and notification of lack of CPR activity. The MRX then automatically stores critical event data from all 4 modes for later download to Philips' data management solution, HeartStart Event Review Pro. No matter where you work, the MRX can be configured to meet your clinical needs. For this program, we'll demonstrate operation using the default configuration settings. Be sure to familiarize yourself with your device's configuration before using the MRX. Prior to using the MRX, you should also review the accompanying documentation such as the instructions for use for additional information about its operation. In this program, we'll provide an overview of the MRX's features, explain how to monitor ECG, SpO2, NBP, invasive pressures, CO2, and temperature, manage alarms, and display trending data. Briefly cover how to view a 12-lead ECG and demonstrate AED and manual defibrillation, QCPR measurement and feedback, sync cardioversion, and pacing therapy. Let's start with a look at the device's basic controls, how to use the ready-for-use indicator, battery operation, and how to perform operational checks. The MRX controls and connections are carefully organized to facilitate ease of use. Ports for monitoring cable connections are on the left. ECG, SpO2, non-invasive blood pressure, invasive pressures, CO2, and temperature cables plug in here. Therapy ports for paddles or multifunction electrode pads are on the other side. There's also a slot for a data card, so you can transfer patient information. Operating controls and indicators are on the front. This is the ready-for-use indicator. The flashing hourglass tells you that the device passed its last self-test and is ready to go with sufficient battery power for defibrillation, pacing, and ECG functions. The therapy knob is the on-off switch. Just turn it to the desired mode of operation.
The information on the large color display is customized for each mode, and its layout may vary depending on your device version and its installed options.
In monitor mode, the display includes 4 wave sectors and 2 parameter blocks with related measurements. In AED and manual modes, the screen displays an enlarged ECG waveform and event timer. The MRX is configured to populate each wave sector with a predetermined waveform. Wave sector 1 will only contain an ECG waveform, which is used by the arrhythmia, heart rate derivation, and AED analysis algorithms. If the configured source is not connected to the device when turned on, the first valid ECG source is displayed in wave sector 1. Wave sectors 2 through 4 are automatically populated when parameter cables or tubing are connected. If you connect a parameter source that's not configured to be displayed, it appears in the first empty wave sector. All modes display general status information including patient category, date and time, and the battery power indicators. In-op statements appear here indicating an equipment problem. Alarm messages appear next to the parameter they are associated with. The MRX also displays an event timer which shows the elapsed time since turning on the device. Press the Mark Event button to insert a time-stamped annotation on the ECG strip and in the event summary report to document medication administration or a procedure. The Lead Select button changes the ECG lead in wave sector 1, cycling through the available ECG waves and changing the displayed wave and its label. These controls are used for automated or manual defibrillation. Below the display, there are 4 soft key buttons that perform the function listed on the soft key label immediately above. The functions change according to the function you are performing. This is the Alarm Pause button. It pauses all alarms for a configured time interval. This message indicates the alarm pause and its duration. At the end of the pause interval, each alarm returns to its previous setting. Press it again during the pause interval to return alarms to their previous settings.
Press this button for access to either print event summary or to print out a trend report.
Press the Menu Select button and a menu appears to provide access to additional functions. Press the up or down navigation buttons to scroll through the available choices until the desired selection is highlighted. Press the Menu Select button again to activate the highlighted selection.
Press the Print button for a continuous printout of the primary ECG. If you have a 50 mm printer, you can select an additional waveform to print out in Sector 2. With a 75 mm printer and software version 7.00 and later, you can select 2 additional waveforms to print in Sectors 2 and 3. Press the button again to stop printing. To load a new roll of printer paper for a 50 mm printer, open the printer door by pushing on the latch. Remove the empty paper roll by pulling up on it. Place a new roll of printer paper into the paper well, positioning the roll so that the paper is on the bottom and the grid faces up. Pull the end of the paper out past the paper roll and close the printer door. To learn how to load printer paper for a 75 mm printer, consult the instructions for use.
The top of the standard Heart Start MRX consists of a handle and quick instructions on ECG monitoring, sync, manual defib, and AED. This is also the location for external paddles if they are ordered as an option. Keep in mind that the MRX paddle set comes with pediatric paddles included. The MRX is powered by rechargeable lithium-ion batteries. Two compartments on the back of the MRX house the batteries. Or you can use compartment B to connect an AC power module. Here is a DC power input connector. Connect either AC or DC power to charge batteries. Once connected, this indicator lights to tell you the battery is charging. To install the batteries, align the lithium-ion battery in the battery compartment and insert the battery until you hear it click into place. These screen icons indicate the presence of two fully charged batteries. As the batteries drain, the full icons become progressively hollowed. This X in the icon indicates no battery or the presence of AC power. To assess operational performance and alert you if a problem exists, the MRX routinely performs automatic self-tests. The results of the tests are reported through the Ready for Use indicator and messages when you turn the device on. The blinking black hourglass symbol indicates the shock, pacing, and ECG functions of the device are ready for use, and sufficient battery power is available for device operation. Additionally, a blinking black hourglass, together with the presence of external power, AC or DC, indicates that installed batteries are being charged. A blinking red X and a periodic audio chirp indicate a low battery condition. The device can be used, but its operation time is limited. If a battery is inserted and charging, the audio chirp is not present. A solid red X and a periodic audio chirp indicate a failure has been detected that may prevent the delivery of defibrillation therapy, pacing, or ECG acquisition. A device error message will display at power on for the first failure detected. A solid red X without periodic audio chirps indicates either there is no power available or a catastrophic failure has occurred. The device cannot power on. If after power is supplied the indicator reverts to the blinking black hourglass symbol, the device is once again ready for use.
To supplement these automatic tests, you should perform periodic shift checks and weekly shock tests or operational checks on the device. The American Heart Association recommends completing a shift check at the beginning of each change in personnel to help ensure that defibrillators are ready when needed. Philips provides a checklist to complete a shift check on the MRX, including the Ready for Use indicator and related accessories and supplies.
The op check covered in this video, which is quite easy to complete, deals with software version B.05 and later MRXs. Consult the instructions for use for op check information on devices earlier than B.05. To perform the operational check, turn the therapy knob to Monitor. Then press the Menu Select button. Using the navigation buttons, select Other and press the Menu Select button. Select Op Check. Select Run Op Check. Then press the Menu Select button again to start the process. This message lets you know that you are exiting from all clinical functionality and entering a test mode. Be sure to connect all cables and accessories as instructed on the display prior to running the operational check. If everything is set up as expected, the series of tests will begin. If not, you will be prompted to correct the setup, proceed with the test based on the current setup, or exit op check. As each test is run, the message window In Progress displays. When prompted, follow the on-screen instructions. You are given a pass or fail indication upon completion of each test. When the op check is done, a report is printed automatically. The first part of the report lists test results. The second part lists additional checks you should do to make sure that you have the necessary supplies and accessories and they are all in good working order. For details about these additional checks, consult the instructions for use.
With the HeartStart MRX, you can monitor ECG, pulse oximetry, non-invasive blood pressure, invasive pressures, end-tidal carbon dioxide, and temperature, and use the diagnostic 12-lead ECG function.
When monitoring ECG using the MRX, you can use the multifunction defib electrode pads, or monitoring electrodes attached to a 3, 5, or 10-lead set. The ECG cable is color-coded and keyed to fit the ECG port on the measurement connector module. For proper lead placement in 3, 5, and 10 lead sets, consult the instructions for use. The monitoring leads available depend on what type of ECG cable is connected to the MRX. Press the Lead Select button to display the desired lead in wave sector 1. To change the waveform displayed in wave sector 2, 3, or 4, press the Menu Select button, navigate to Waves, select the desired wave, and press Menu Select again. Select the desired lead. And finally, choose the preferred wave size and press Menu Select again. The MRX uses the STAR basic arrhythmia algorithm for monitoring arrhythmia. It monitors pediatric and adult patients' ECGs for heart rate and ventricular arrhythmias and generates alarms. It specifically uses the ECG lead appearing in wave sector 1 for single-lead arrhythmia analysis. Note that increasing the wave size does not affect arrhythmia analysis. If the device is not identifying the patient's rhythm correctly, you need to initiate relearning. To do this, press the Menu Select button. Navigate to Measurements, Alarms, and then HR Arrhythmia. Select Relearn Rhythm and press Menu Select. The MRX will then display a message confirming that manual relearning has begun. Now, let's set up SpO2 monitoring. Insert the blue connector into this port located on the measurement connector module. When choosing a location for the SpO2 sensor, the most important consideration is to pick a site that is warm and has good perfusion. Apply the appropriate sensor to the patient. A pleth wave displays while the oxygen saturation is measured and the value is calculated. Within seconds, an oxygen saturation reading and patient pulse rate appear. As the patient's oxygen saturation changes, the SpO2 value is updated continuously. The MRX can also monitor non-invasive blood pressure. The measurement can be done automatically or manually. The first step is to select the appropriate size cuff. A properly sized cuff should span approximately 2/3 of the distance between the elbow and the shoulder, and wrap around the limb meeting in the indicated area. Attach the cuff to the tubing and the tubing to the NBP port on the measurement connector module. To perform an NBP measurement, press the Start NBP soft key. The cuff inflates and then slowly deflates. If you need to stop the NBP reading, press the Stop NBP soft key. The NBP measurement appears on the screen as systolic followed by diastolic with the mean arterial pressure in parentheses. To schedule automatic NBP readings at regular intervals, press the Menu Select button. Navigate to Measurements Alarms, NBP, and NBP Schedule. Select the desired interval and press Menu Select again. Automatic measurements begin based on the interval set. The automatic time interval appears here on the screen. Can also measure carbon dioxide or CO2. Philips uses the microstream method of side-stream CO2 measurement. The first step in setting up the microstream system is to select the appropriate filter line. There are 5 factors to consider when selecting the filter line. Patient situation, ventilated or not ventilated. Patient type, adult or pediatric. Ventilation type, humidified or non-humidified. The need for supplemental oxygen delivery. And the likelihood that the patient will switch between oral and nasal breathing. There are 2 filter line options in microstream monitoring, non-intubated nasal cannula and a filter line with an airway adapter. When using the nasal filter line, check that both nostrils are clear. Position the nasal filter line on the face by inserting the filter line tips into the nostrils. Pass the filter line tubing over the ears. Slide the sleeve up the tubing towards the neck for a comfortable fit under the chin. Check the positioning of the filter line to ensure proper detection during monitoring. When using a filter line set, place the pre-attached airway adapter on the ET tube. Attach the female lure connector of the nasal cannula or airway adapter to the CO2 inlet connector on the measurement connector module. Regardless of type, nasal or intubated, verify that the filter line is not kinked. To remove exhaust gases from the system, connect an exhaust tube or closed-loop kit to the connector. Evaluate the filter line if a CO2 occlusion inop appears or if the readings become extremely erratic. There are 2 numerics associated with CO2 monitoring. The first, EtCO2 or end tidal carbon dioxide, is the peak CO2 value measured at the end of each expiration. The second is AWRR, airway respiration rate, the number of breaths per minute. In addition to the numerics, the monitor also displays the CO2 waveform or capnogram. This is the normal capnogram shape. It is important to note that on a capnogram, positive deflections represent expiration, whereas negative deflections represent inspiration, which is the opposite of most respiratory waveforms. With each measurement that the MRX monitors, there are alerts to advise when your patient's condition requires attention. Specifically, there are 3 alert levels: red alarm, yellow alarm, and inop message. A red alarm warns of a life-threatening condition, such as asystole or ventricular fibrillation. The cause of the alarm displays here with a red background and sounds like this. A yellow alarm indicates a non-life-threatening condition, such as when the heart rate measurement violates the high or low limits. The cause of the alarm displays with a yellow background and sounds like this. Arrhythmia alarms are also categorized as latching or non-latching alarms. With a latching alarm, visual and audible indicators remain present until they are silenced and acknowledged, regardless of whether the alarm condition still exists. With a non-latching alarm, visual and audible indicators disappear when the condition no longer exists. Inops indicate a device problem or error condition, such as this leads off message, and they appear in this cyan background and sound like this. To silence active alerts, you use the menu select or the navigation buttons. Once the condition is corrected, press the menu select button to acknowledge the alarm. Setting high and low alarm limits and turning alarms on or off is the same for all measurements, so let's look at how to do these tasks using pulse and SpO2 as examples. To set the high and low limits, press the menu select button. Navigate to Measurements Alarms, SpO2, and SpO2 Limits. The high limit appears in this window. Use the up or down navigation buttons to increase or decrease the high limit. Press Menu Select to set the new high limit. Now the low limit appears. Use the navigation buttons again to adjust the low limit and press Menu Select to set the new low limit. The current high and low limits for each measurement appear next to its measurement numeric. Setting the high and low alarm limits for other monitoring parameters is similar to what you've just seen. If you need to turn off an alarm, start by pressing the Menu Select button. Navigate to Measurements, Alarms, Pulse, and Alarms Off. The menu closes and this icon appears next to the pulse rate, indicating that the pulse rate alarm is off. The HeartStart MRX can store up to 12 hours of vital signs trending data for review or printing. To view the stored trending data, the HeartStart MRX must be in monitor mode. Press the Menu Select button. Navigate to Trends and press the Menu Select button. The trending report displays here. Most recent data is to the right and older data to the left. As new data is acquired, it displays on screen. The trending report only displays measured parameters. This symbol indicates invalid data, while the same symbol before a numeric indicates questionable data. A blank space indicates data that is unavailable. Periodic measurements such as NBP include a timestamp. Use these soft keys to scroll backward and forward in the vital signs trending report. When there is no more data in a particular direction, the soft key becomes inactive. You can adjust the display's time interval for the current patient. With vital signs trending active on the display, press the Menu Select button. Navigate to Trend Interval and press the Menu Select button. Use the navigation buttons to select the trend interval you want and press the Menu Select button. To exit the trending report, press the Close Trends soft key. When using a 10-lead ECG cable, you can view a 12-lead ECG to identify or confirm cardiac problems such as myocardial ischemia. Following placement of the 10-lead electrodes and connection to a 10-lead set, press the 12-lead soft key. You can now preview all 12 leads on the display. Press the Start Acquire soft key. The MRX prompts you to enter the patient's age and sex. This information is required to correctly analyze the 12 lead. After entering the required information, ECG acquisition takes place. This is followed by ECG data analysis. Upon completion of analysis, the 12-lead report screen displays. The MRX then automatically prints an interpretive 12-lead report based on the configured analysis setting. With monitoring setup complete, we can now turn our attention to the therapeutic use of the device. The HeartStart MRX provides therapy options including automatic and manual defibrillation, synchronized cardioversion, and pacing. When operating in AED mode, the capabilities of the MRX are restricted to those essential to performing semi-automatic external defibrillation. You turn the therapy knob to AED and the MRX advises you to
connect PADS cable. Apply pads to patient's bare chest. Plug in PADS connector.
connect the pads to the pad's patient cable. Apply the multifunction electrode pads as directed on the package.
Analyzing heart rhythm. Do not touch the patient.
The MRX analyzes the heart rhythm and announces if a shock is advised.
Shock advised.
The MRX automatically charges to 150 joules.
Deliver shock now.
Make sure no one is touching the patient or
Press the
anything
orange
connected to the
button now.
patient. Upon delivery of the shock,
Shock delivered.
the shock counter registers the number of shocks delivered. After a shock is delivered, the device pauses and you are prompted to
Paused. If needed, begin CPR.
The MRX reanalyzes the ECG when the pause period ends or you press Resume Analyzing.
Analyzing heart rhythm. Do not touch the patient.
If a shockable rhythm is not detected, the device tells you
No shock advised.
The MRX supports the American Heart Association's and European Resuscitation Council's 2005 resuscitation recommendation of immediate CPR after a no-shock advised decision, or after one shock is delivered. The device prompts you.
Paused. If needed, begin CPR.
Analysis is suspended during the pause period, which you can configure for the recommended 2 minutes, during which time you can administer CPR.
the Q-CPR measurement and feedback option is used during CPR on patients at least 8 years of age or more than 25 kilograms in weight. It requires use of the PADS CPR cable with multifunction defib electrode pads to measure ventilations and the compression sensor to measure compressions. In this program, we're demonstrating placement of the pads first, then placement of the compression sensor. The sequence of placement may depend on the patient's condition and your particular resuscitation protocol. It is recommended that the PADS CPR cable and compression sensor cable connections and sensor adhesive pad application be made prior to patient care or emergency. The PADS CPR cable is connected to the MRX's therapy port. Align the key marker on the compression sensor cable with the key marker on the receptacle end of the PADS CPR cable. Push until you hear it click into place. Peel the liner from the bottom of the sensor adhesive pad. Align it with the yellow area of the sensor and press it into place. The green surface of the sensor pad indicates that the sensor is prepared for CPR. As soon as possible, apply the multifunction pads to the patient's bare chest in the anterior position only, and verify the PADS cable connector is connected to the PADS CPR cable. Please remember that the anterior pads placement is required because a ventilation algorithm interprets change in chest impedance based on the anterior placement. Next, with the patient's skin clean, dry, and free of hair, pull the yellow tab to peel the green liner away from the sensor adhesive pad. Position the compression sensor on the patient as shown in the graphic displayed on the green liner, which is on the lower half of the sternum. This is the same location where you would place the heel of your hand while performing CPR without the compression sensor. Voice prompts may be used to guide CPR activity.
Ventilate a little less forcefully.
You can adjust the volume, or if you wish, you can mute those prompts. Depending on your mode, manual defib or AED, the screen will look different. In manual mode, the compression waveform appears here and is labeled comp. As the chest is compressed, the wave's downward stroke occurs. As pressure is released, the wave rebounds up to a baseline. These lines define a target zone to help you achieve good compression depth, which is accomplished when the compression peak of the waveform appears between the lines. This area contains the numeric values for compression rate, no flow time, and ventilation rate, and a ventilation volume icon. The compression and ventilation rates are a moving average rate measured per minute. The no flow time indicates no CPR activity beginning at 2 seconds and incremented with each additional second of inactivity. The ventilation volume icon depicts the approximate level of ventilation volume. There are 4 states of volume: empty, 1/3 full, 2/3 full, and full. If ventilation cannot be measured, lungs marked with a question mark appear.
Analyzing
In
heart rhythm.
AED mode, there is no compression
not
wave or
touch the
numeric
patient.
value for compression rate, no flow time, or
No
ventilation
shock
rate.
advised.
QCPR
Pause.
provides CPR feedback automatically during the CPR pause period of the AED protocol or when the CPR pause soft key is pressed.
Don't compress so deep.
As in manual defib mode, voice prompts guide you, if necessary.
Release pressure between compressions.
However, in AED mode, prompts are accompanied by corresponding momentary text messages appearing on the display. Survival from cardiac arrest requires quick recognition, rapid response, early defibrillation, and ACLS intervention. Understanding the operation of your Zoll M-Series before you encounter an emergency situation will enhance your potential to save victims of cardiac arrest. Users should review the first M-Series in-service video for basic operation of the M-Series for manual defibrillation, advisory function, electrode placement, and proper battery maintenance. This second program will introduce you to the Zoll M-Series with Zoll's low-energy rectilinear biphasic waveform, AED function, and additional monitoring parameters including pulse oximetry, 12-lead ECG, end-tidal carbon dioxide monitoring, and non-invasive blood pressure. M-Series are now available with a choice of 2 defibrillation waveforms. Some M-Series are equipped with a monophasic waveform, and some offer Zoll's new low-energy rectilinear biphasic waveform. The rectilinear biphasic waveform offers superior defibrillation capabilities at lower energy settings. The suggested 3-shock VF protocol for monophasic waveforms is 200, 300, and 360 joules. The suggested biphasic 3-shock VF protocol is 120, 150, and 200 joules. Successive low-energy shocks should remain at 200 joules. Recommended pediatric settings should remain consistent with monophasic joule settings. Users should consult your medical authority to confirm pediatric settings. Biphasic energy levels for internal defibrillation should also remain consistent with monophasic protocol, unless otherwise directed by your medical authority. This video depicts the use of biphasic defibrillators. Other than energy levels, there are no operational differences between biphasic and monophasic M-Series devices. The M-Series defibrillator monitor is capable of analyzing a patient's ECG to identify if a shockable rhythm exists when using multifunction electrode pads. To use the AED feature, the selector switch must be turned to on. The M-Series is capable of analyzing a patient's ECG rhythm in 2 different ways.
Stand clear.
The first is always active in the semi-automatic mode, when MFE pads or ECG cable and electrodes are in use. The second is user-activated,
Stand clear.
initiated by pressing the Analyze button. The M-Series AED may be configured to automatically analyze on power-up. Also, the M-Series may be configured to automatically charge if a shockable rhythm is determined.
Press shock.
Consult your M-Series Operator's Guide for detailed information on ECG analysis and automated external defibrillator operation. To use the AED in the semi-automatic mode, verify the patient is unconscious, not breathing, and pulseless. Request assistance, begin CPR, and remove clothing covering the patient's chest.
If not pre-connected, connect the MFE pads to the multifunction cables. Apply the MFE pads according to directions on the package. Pads may be applied in anterior-posterior or apex-sternum positions. Ensure that all MFE pads are making good contact with the patient's skin and are not covering any part of the ECG electrodes. Set the selector switch to on. The unit will beep 4 times to indicate that it has passed the power on self-test. If the audio recorder is present, the unit will begin recording audio data.
Attach pads.
On power-up, the message and voice prompt, "Attach pads," will be issued if ECG electrodes or MFE pads have not been attached to the patient.
Check pads.
If the pads become detached or the connection is broken, a "Check pads" message and voice prompt will be issued. Biphasic M-series defibrillator default settings are shock number 1 at 120 joules, shock 2 at 150 joules, and shock 3 and up set at 200 joules. If your M-series utilizes a monophasic waveform, default settings are 200, 300, and 360 joules. If medical protocols allow, the operator may select any of the pre-configured energy levels using the Energy Select up or down arrow buttons. The new energy level will display on the monitor. Press the Analyze button to begin the analysis of the patient's ECG rhythm.
Stand clear.
A Stand Clear message and voice prompt will be issued. An Analyzing ECG message is then displayed while the patient's ECG is analyzed. If MFE pads have not been properly connected to the patient, a Use Pads message will be displayed and analysis will be inhibited. Warn all persons attending the patient to stand clear.
Stand clear.
No one should touch the patient, bed, or any equipment connected to the patient during defibrillation. A severe shock can result. When analysis is complete, the unit indicates whether or not a shock is advised.
Stand clear.
When a non-shockable rhythm is detected, the No Shock Advised message and voice prompt are issued.
No shock advised.
Immediately check the patient's pulse and breathing and resume other treatment per protocol. If the patient's rhythm is shockable, the unit will display a Shock Advised message.
Press shock.
If so configured, the defibrillator will automatically begin charging to the pre-selected energy setting and display a charging message.
Press shock.
When the unit is charged and ready, the shock button will illuminate and the Press Shock message and voice prompt will be issued.
Press shock.
Press and hold the shock button on the front panel until the energy is delivered to the patient. Observe the patient or the ECG response to make certain the shock has been delivered. A continuous tone will sound for 10 seconds, followed by an intermittent beeping for 5 seconds. The shock must be delivered within this 15-second interval, or the defibrillator will disarm itself.
Press analyze. Press shock.
After the shock,
Check pulse.
the display returns to the energy selected and indicates the number of shocks delivered to the patient. Press the Analyze button to restart an ECG analysis and determine if additional shocks are required. If so configured, the M-series will automatically analyze and recharge.
Press shock.
The unit uses both audio and visual prompts to present critical information to operators. Please consult the M-series Operator's Guide for detailed information on voice prompts and operating messages, which can occur during semi-automatic operation. If your device has been custom configured, some information may be different. Press the Manual Mode soft key on the front panel of the unit to enter the manual mode of operation. If the Confirm soft key is not pressed within 5 seconds, the unit will revert to semi-automatic operation. If the M-Series has been configured to require an access code, Enter Access Code will be displayed, and the operator will have to enter a 3-digit access code by pressing the soft keys corresponding to the correct digits. If the MFE pads are not making good contact, or if a short circuit between the pads exists, 2 messages, Check Pads and Poor Pad Contact, will be alternately displayed, and energy will not be delivered. Please refer to the previous in-service videotape and M-Series Operator's Guide under Manual Defibrillation, Advisory Defibrillation, Pacing, and ECG Monitoring sections for the appropriate detailed instructions for operation in the manual mode. M-Series defibrillators may be equipped with Masimo's patented set pulse oximetry technology, which offers superior performance during motion, low perfusion, and high ambient light conditions. For detailed instructions on proper sensor size, application, and detailed operating instructions, please see the pulse oximetry insert in the M-Series Operator's Guide. To use the M-Series with SPO2, attach the SPO2 cable to the Masimo connector on the rear of the M-Series. Plug the sensor into the SPO2 patient cable. The reusable sensor is simply placed over the appropriate site. Attach the sensor to the patient. Choose a site that is well perfused and one that is least likely to restrict patient movements. The ring finger or middle finger of the non-dominant hand is preferred. The disposable sensor should be placed by carefully following the instructions on the package. Turn the M-Series selector switch to on if you are using an AED, or to monitor for advisory and manual devices. A dashed line will be displayed in the SPO2 field until a pulse is detected. Once the measurement has been established, the saturation values will be displayed in the numeric window. If ECG leads or pads are not attached, the patient's pulse rate, as measured by the SPO2 sensor, will be displayed as the heart rate in the ECG field. When the parameter soft key is pressed, the Select, Enter, and Return soft keys will be displayed. Pressing the Select soft key allows you to scroll through different physiologic parameters if available. Selecting the SPO2 soft key causes the following soft keys to appear: Sensitivity, Average, Alarms, and Return. The Sensitivity soft key allows the user to select either normal or high sensitivity for SPO2 monitoring. The normal setting is recommended for most patients. The Average soft key provides 3 different time periods over which SPO2 values are averaged: 16 seconds, 4 seconds, 8 seconds, which is the default setting. The Return soft key returns the operator to the previous screen. If desired, the user can select a plethysmographic waveform by pressing the Wave 2 soft key until the desired waveform is displayed. If the monitor is equipped with end-tidal CO2, the ETCO2 waveform will be displayed with the first press of the Wave 2 soft key. Pressing the Wave 2 soft key again displays the SPO2 waveform. Press the Alarms soft key to display the Set Alarm screen and corresponding soft keys. This screen allows users to enable or disable alarms. Consult the Operator's Guide for detailed instructions on alarms, their priorities and limits, and how pulse oximetry operates in AEDs. M-Series defibrillators may be equipped with 12-lead ECG capabilities that provide simultaneous acquisition, storage, display, and ECG analysis using the GE Medical Systems 12SL program. Transmission to a fax machine or directly to GE Medical Systems Catalyst Muse is also available. Users should read the detailed instructions found in the M-Series 12-lead ECG Monitoring Operator's Guide.
The M-Series Operator's Guide also gives detailed instructions on entering patient data. To acquire a 12-lead ECG, the one-step patient cable should be inserted into the ECG cable connector in the rear of the M-Series. Care should be taken to properly prep the patient's skin. This may include clipping excessive hair and light abrasion of the skin to ensure proper electrode contact. High-quality silver-silver chloride electrodes should be attached to the ECG cable snaps and placed on well-prepped skin. When V-leads are not in use, users must plug the protective cap into the V-lead connector on the one-step patient cable. When V-leads are required, the V-lead connector should be pressed securely into the one-step patient cable. On manual M-Series defibrillators, turn the selector switch to monitor. On M-Series with AED, the switch should be turned to the on position. If pads or paddles are selected, select one of the leads. When the M-Series is equipped with 12-lead capabilities and the selector switch is turned to monitor, the physiological monitoring menu will be displayed with the following soft keys: parameter, wave 2, ID number, alarms, and 12-lead. To rapidly acquire a 12-lead, press and hold the recorder button for 3 seconds. A 4x3 12-lead report without interpretation will be printed. When the 12-lead soft key is pressed, the following screen will be displayed. Pressing the Acquire soft key begins the 12-lead acquisition process. The acquiring ECG message will be displayed, and the Acquire soft key changes to Halt. The 12-lead ECG interpretation and measurements will print if so configured. The Halt soft key can be pressed at any time to abort the 12-lead process. When the Halt soft key is pressed, the acquisition halted message is displayed. If one or more of the V-leads should become detached during the acquisition process, a V-lead lead-off message will be displayed on the screen. When 10 seconds of valid data have been acquired by the device, the message Acquisition Complete will be displayed, and the unit will proceed to the data transmission screen if so configured. Please consult the M-Series Operator's Guide for detailed instructions on phone number entry and data transmission. In the event that a 12-lead ECG record fails to transmit, the operator will be notified and the M-Series will continue to retry the transmission until either the transmission is successful or the operator aborts the attempt. The Settings soft key allows the user to change the ECG filter, lead group settings, or the dial type for telephone transmission. Selecting the Filter Settings soft key allows the user to select among the following 3 settings for 12-lead monitoring: 0.05 to 150 Hz for monitoring 12 leads in a diagnostic bandwidth, 0.05 to 150 Hz for continuous printout, 0.05 to 40 Hz for monitoring 12 lead when excessive artifact is present. This setting may also be used to acquire a 12-lead ECG under difficult conditions. The M-Series with 12-lead option allows 3 ECG lead signals to be simultaneously printed on the multiple application printer when using a 12-lead cable with one of those 3 leads selected. Consult your operator's guide and M-Series configuration guide for more information on setting lead groups. Dial type allows the user to select between pulse and tone dialing when connected to a telephone. Press the Alarms soft key to display the Set Alarm screen and corresponding soft keys. This screen allows users to enable or disable alarms. Pressing the Patient Information soft key allows the user to enter pertinent patient data, such as the patient's name and ID number. Pressing the Age soft key allows the user to enter the patient's age. The Gender soft key is used to identify the patient as male or female. The Patient Record soft key allows for reviewing printing or transmission of a previously stored 12-lead recording. Pressing the Return soft key returns the operator to the previous screen.
Your M-Series may be equipped with a Novometrics N-Tidal CO2 monitoring option, which continuously measures carbon dioxide and respiratory rate using a unique mainstream solid-state sensor called a capnostat. Please review the N-Tidal CO2 Operator's Guide insert for detailed instruction. Attach the capnostat CO2 sensor cable to the CO2 connector at the rear of the M-Series. Turn the selector switch to monitor. Wait for the CO2 sensor to warm up. This will take approximately 60 seconds or less. The message CO2 sensor warm up will disappear when the capnostat is ready for use. The first time a particular capnostat sensor is connected to the M-Series, a 0 CO2 sensor message will be displayed after the sensor is warmed up. This is only required when a capnostat is plugged into an M-Series for the first time. The same capnostat may be unplugged and replugged into the same M-Series without re-zeroing. Place the sensor on the 0 cell, which is attached to the sensor cable. A zeroing CO2 sensor message will be displayed for about 15 seconds while the sensor is automatically zeroed. The sensor's zero calibration can be checked by placing the sensor on the reference cell. An EtCO2 value of 38 millimeters of mercury, plus or minus 2 millimeters of mercury, should be displayed. Attach the airway adapter to the capnostat. The first time a given adapter type is attached to the capnostat, it must be zeroed. To zero the adapter, press the parameter soft key. Select the EtCO2 menu item, then press Enter. Press the 0 soft key. Select Start using the 0 soft key, then press Enter. Zeroing CO2 adapter will be displayed for about 15 seconds. An airway adapter 0 will be required after switching between different airway adapter types, but is not required when switching between the same type of adapters. Multiple color-coded disposable and reusable adapters are available. Consult the Operator's Guide for assistance in selecting the proper adapter, adapter setup, location in the breathing circuit, and how to clean reusable adapters. The M-Series with the N-Tidal monitoring option monitors both CO2 and respiration rate. The results are displayed in the CO2 field located on the M-Series display. The maximum concentration of CO2 detected during each breath is displayed, along with the number of breaths per minute labeled RR. With the M-Series in the monitor mode, the main monitoring menu is displayed with the following soft keys: Parameter, Wave 2, ID number, and Alarms. When the Parameter soft key is pressed, the Select, Enter, and Return soft keys will be displayed. Pressing the Select soft key will scroll through the different available physiological monitoring functions. Pressing the Enter key allows the user to select the parameter that is highlighted. The Return soft key allows the user to return to the physiological monitoring menu. Selecting the EtCO2 parameter causes the following soft keys to appear: 0, Average, Compensation, Scale, and Return. The 0 soft key allows the user to begin the process of zeroing the adapter. The Average soft key provides 3 different time periods over which the highest EtCO2 values are averaged: 10 seconds, 20 seconds, or 1 breath. The Compensation soft key provides compensation for elevated levels of oxygen, 60% or greater, and for the presence of nitrous oxide, or both. The Scale soft key allows the user to select the scaling on the display of the capnographic waveform. The Return soft key allows the user to return to previous screens. The M-Series is capable of displaying a capnographic waveform on the screen and also provides printing capabilities. To display a second waveform, press the Wave 2 soft key. Pressing the Wave 2 soft key will toggle the display between EtCO2 and SpO2. Pressing the ID number soft key allows the user to enter the patient's identification number. If your M-Series is equipped with non-invasive blood pressure, you have the ability to measure arterial blood pressure in resting patients. Please consult the NIBP insert in the M-Series Operator's Guide for a complete list of operating instructions and cautions. To take a non-invasive blood pressure, connect the hose to the front of the M-Series. Place the cuff on the patient's arm. Consult the NIBP insert in the M-Series Operator's Guide for a complete list of cautions and advice on proper cuff selection and placement. From the main monitoring menu, press the Parameter soft key to access the Physiologic Monitoring Parameter menu. Press the Enter soft key, and the M-Series will display the following: NIBP Stat, NIBP Auto, Cuff Inflation, Auto Interval, and Return. NIBP Stat allows users to take up to 10 readings within 5 minutes. NIBP Auto allows users to take automatic measurements at preset increments. These increments can be set between 120 minutes and 2.5 minutes. The settings can be easily changed by pressing the Auto Interval soft key and pressing the Increase or Decrease soft keys to adjust the settings. Before taking a measurement, check that the initial cuff inflation pressure is appropriate for the patient. The default cuff inflation pressure is 160 millimeters of mercury. To adjust the inflation pressure, press the Cuff Inflation soft key and then press the Increase or Decrease keys. If the auto feature is set to off, the selected cuff inflation pressure is used for all measurements. If the auto feature is set to on, the selected cuff inflation pressure is used for only the first measurement. After the first measurement, the cuff inflation pressure automatically adjusts to 30 millimeters mercury greater than the systolic value of the previous measurement. To take a single measurement, press the NIBP button. The cuff inflation bar reflects the status of the cuff inflation pressure. This cycle takes approximately 30 seconds. The M-Series will not start a new measurement unless 30 seconds have elapsed since the end of the previous completed measurement cycle. To take stat measurements, press the NIBP button and hold it for 2 seconds. Or press the NIBP Stat soft key. You can abort the NIBP Stat process by pressing the NIBP button, or by pressing the NIBP Stat soft key for a second time. To take automatic measurements, first select the appropriate interval, then press the NIBP Auto soft key. To stop the process, press the NIBP button. If a systolic pressure cannot be detected, the M-Series immediately increases the cuff inflation pressure and completes the measurement. If after 180 seconds the M-Series has not been able to determine systolic, diastolic, or mean pressure, it aborts the measurement and deflates the cuff. After each measurement, the NIBP display area displays systolic, diastolic, and mean blood pressure values. If the M-Series is unable to detect a measurement due to excessive motion or vibration, an asterisk is displayed and the message Repeat NIBP Measurement will alternate with NIBP Artifact. By pressing the Summary key, then pressing the NIBP History soft key, the NIBP history will be displayed. Pressing the Print soft key will print NIBP, SpO2, and EtCO2 measurements if present. Pressing the Return soft key returns the user to the main menu. Please consult the M-Series Operator's Guide for detailed instructions on enabling and disabling alarms and how NIBP operates in the M-Series. For additional detailed information on the operation of your M-Series, contact your Zoll representative or Zoll Technical Support.